Good afternoon and welcome to Downing Street for today's coronavirus press briefing. I'm joined by our National Medical Director for the NHS, Professor Steve Powis, and Professor of Public Health and Epidemiology at Manchester, Professor John Newton. Our step-by-step action plan is aiming to slow the spread of the virus so fewer people need hospital treatment at any one time, protecting the NHS's ability to cope. At each point, we've been following scientific and medical advice, and we've been deliberate in our actions, taking the right steps at the right time. We're also taking unprecedented action to increase NHS capacity by dramatically expanding the numbers of beds, of key staff, and life-saving equipment to the front line, to give people the care they need when they need it most. I've been away for a week now, and I'm delighted to be back. In the past week, we've completed the construction of a whole new hospital, the NHS Nightingale Hospital in London, built in 9 days. With 4,000 beds, this is the equivalent of 10 district general hospitals. And there's more to come in Birmingham, Manchester, and Glasgow, where the military have been working wonders in helping to construct. This has been an incredible achievement, and I want to thank everybody involved. I also want to thank everyone who has followed the social distancing guidelines and the admirable fortitude and spirit of the British people in following these rules. And Steve will update us on the progress that's being made and how people are following those rules. And I want to pay a huge tribute to all of the councils, the primary care, community care, pharmacies, and unbelievable 750,000 volunteers who've signed up for shielding the most vulnerable. This is Britain at its best. Sadly, the coronavirus continues to grow. I can report that through the government's ongoing monitoring and testing programme, that according to the latest figures, 163,194 people have now been tested for the virus. 33,718 have tested positive. And the best scientific analysis is that the rate of infection has been doubling every 3 to 4 days. The number of people admitted to hospital with coronavirus symptoms is now 12,949. Of those who've contracted the virus, 2,921 have sadly died. We express our deepest condolences to the families and to the friends of the victims. If the past few weeks have shown us anything, it's that we are steadfast as a country in our resolve to defeat this invisible killer. I'm profoundly moved by the compassion and the commitment that we're seeing from people right across the country. And in the health and care system, we've lost colleagues too. Doctors, nurses, mental health professionals, they have paid the ultimate price for their service, working to care for others. And I just want to say this on behalf of all my colleagues in health and social care. I am awed by the dedication of colleagues on the front line, every single person who contributes to the running of this diverse and caring institution that our nation holds so dear. Many of those who've died, who are from the NHS, were people who came to this country to make a difference, and they did, and they've given their lives in sacrifice, and we salute them. And I tell you this, I come back redoubled in my determination to fight this virus with everything I've got, and we will strain every sinew to defeat it once and for all. And I'll stop at nothing to make sure that frontline staff have the right equipment so that they're safe and can have the confidence they need to do their jobs. And I know that people have been asking questions about protective equipment. With the support of the British military, we've shipped a record quantity of equipment to the front line. Just yesterday, 45 million pieces of protective equipment were delivered across health and social care, including more than 5 million aprons and 6 million surgical masks. Today, Public Health England have announced the upgraded PPE standards that people should use and expect. The upgraded guidance has been developed through intense consultation with stakeholders right across the board and staff on the front line. We have listened, we've put the interests of health and care staff first and put them at the heart of this. The new guidance recommends the appropriate level of PPE to protect people in all circumstances. These standards are amongst the highest in the world and in line with the recommendations of the World Health Organization. I'm delighted they've been welcomed by the Medical Royal Colleges, the BMA, the Royal College of Nurses, and the trade unions. Any health or care organisation that needs PPE should call the hotline so that our military operation for delivering PPE can get that protective equipment to you. These are unprecedented times for our health and care system, and I want to make sure that every part of it is supported. I've therefore made £300 million available for funding for community pharmacies, who do so much to get vital medicines to people and play such an important part in their communities. They themselves are the NHS frontline. And today, to help NHS trusts to deliver what's needed without worrying about past finances, I can announce that I'm writing off £13.4 billion of historic NHS debt. This landmark step will not only put the NHS in a stronger position to be able to respond to this global coronavirus pandemic, but it will ensure that our NHS has stronger foundations for the future too. But this is only one part of the picture. I quite understand too why people are yearning for the certainty that good testing provides. I get it. Public Health England can be incredibly proud of the world-beating work they've done so far on testing. The rollout of Public Health England's COVID-19 diagnostic test is the fastest deployment of a novel test in recent history, including faster than the swine flu pandemic in 2009. But I'm going to level with you about the challenges that we face and the plan we have to rise to those challenges. I'm going to go through some of the challenges in very specific detail and then talk about the plan we have to drive this forward with a significant increase in testing. First of all, unlike some countries, we didn't go into this crisis with a huge diagnostics industry. We have the best scientific labs in the world, but we did not have the scale. My German counterpart, for instance, could call upon 100 test labs ready and waiting when the crisis struck, thanks in large part to Roche, one of the biggest diagnostic companies in the world. We have had to build from a lower base. Next, there's the demand for materials. There's been a shortage of both swabs and reagents. Thanks to the ingenuity of my team, we have fixed the swabs issue, and we're tackling the shortage of reagents. We're resolving this reagents issue, but as the head of Roche and the President of the United States have commented, this is a global challenge. I'm sure that we'll get there. Next, there's the challenge of prioritization. Look, I understand why NHS staff want tests so they can get back to the front line. Of course I do. But I took the decision that the first priority has to be the patients for whom the result of a test could be the difference in treatment that is the difference between life and death. I believe anybody in my shoes would have taken the same decision. I'm proud that every single patient who's needed a test for life-saving treatment has had access to a test. But of course, NHS staff need access to testing too. And I'm delighted that at the weekend we could roll out this access for the first time. And there's a challenge too of making sure that the public can have confidence in tests. Several of the tests that we're currently checking have failed. In one case, a test that I'm being urged to buy missed 3 out of 4 positive cases of coronavirus. That means in 3/4 of cases, that test would have given the false comfort of sending someone with coronavirus back on the wards. Approving tests that don't work is dangerous, and I will not do it. Now, these are some of the challenges that we've faced, but I want to set out my plan to boost testing. Let's first be clear about the goal. Always to ensure that testing is available to patients who need it. Next, to expand testing to critical NHS staff and their families. And I can announce today that we're expanding testing for NHS staff further. Third, as we ramp up the numbers, we'll test critical key workers, and over time, we'll expand testing to the community. Our ultimate goal is that anyone who needs a test should have one. Now, let me take a moment to set out my 5-pillar testing strategy to achieve these goals. The first pillar is swab testing in Public Health England labs and within the NHS in their hospitals. This is the testing to find out if you currently have the virus. We've already reached a target of 10,000 tests per day, precisely on time, by the end of March, as committed. And we're committed to reaching 25,000 tests per day by the end of April at the latest. Because it allows the NHS to identify and effectively care for those who are most seriously ill, saving lives by helping clinicians decide the most effective treatment options, I can reassure you that every single patient who needs a test is able to have one, and this is how we're going to make sure that people get the right treatment in hospitals. The second pillar is the creation of a brand new swab testing capacity delivered by commercial partners. Again, this is swab testing to tell if people have the virus. The biggest part of Pillar 2 is partnerships with universities, research institutes, and companies like Amazon and Boots to build from scratch a network of new labs and testing sites across the country. This brand new service has just launched and is ramping up rapidly. The trials of this have successfully completed, and the number of tests at this facility will significantly increase from this weekend. To begin with, this capacity will be used solely for frontline NHS staff and their families. Increasing testing capacity for NHS staff will allow more doctors and nurses who do not have the disease safely to go back to work and to treat those who are most in need of care. These are currently in the final stages of development. As of now, over 5,000 NHS workers have been tested across the 5 new testing sites and these testing capabilities. Currently, there are only 5.7% of doctors absent due to COVID-19, but of course we want to get that number down. And we're working with other testing companies to expand Pillar 2, so over time we have many different commercial partners delivering mass swab testing. The third pillar is blood tests. Now, blood tests are designed to tell whether people have had the virus and are now immune. These tests are done by taking a blood sample and looking for the presence of the right COVID-19 antibodies. These could potentially be done at home with a finger prick and deliver results in as little as 20 minutes. We're currently working with 9 companies who've offered these tests and evaluating their effectiveness. These antibody tests, blood tests, offer the hope that people who think they've had the disease will know they're immune and can get back to life as much as possible as normal. But they've got to work. The fourth pillar is surveillance. We're conducting some of the biggest surveys in the world to find out what proportion of the population already have the virus. This is done using an ultra-high accuracy antibody test operated by Public Health England at their Porton Down Science campus. We have capacity for 3,500 of these tests a week, enough for population sampling to begin with. Robust population surveillance programs are essential to understanding the rate of infection and how the virus is spreading across the country. We'll use these tests to help us strengthen our scientific understanding and inform us on the big choices that we have to make about social distancing and how we exit from this crisis. We did not start this crisis with a large diagnostics industry, but that doesn't mean that we can't build one. Just as our top-end manufacturers have joined up the national effort to build ventilators, so the pharmaceutical companies will do the same for testing. Our pharmaceutical giants like AstraZeneca and GSK which have no great history in diagnostics, are now working with our world-leading but small diagnostics companies to build a British diagnostics industry at scale. The new national effort for testing will ensure that we can get tests for everyone who needs them. And I'm delighted that the pharmaceutical industry is rising to this challenge and putting unprecedented resources into testing. Taken together, I am now setting the goal of 100,000 tests per day by the end of this month. That is the goal, and I am determined that we will get there. And to help drive this work forward, I'm pleased that Professor John Newton from Public Health England will be taking on a new role to coordinate this national effort for testing, working with my brilliant departmental officials, the NHS, and the life sciences industry. Professor Newton is widely recognised as a leading voice on public health and epidemiology, and I'm thrilled that we can bring to bear his considerable experience on this vital issue. My 5 pillars represent a comprehensive plan to put in place the testing that is mission critical as we fight this battle against coronavirus. There will be problems, like many of those that we've already overcome. After all, building a brand new industry, it's not easy. There will be bumps in the road and criticisms made, and some of them will be justified. And I return from illness more determined than ever to fight this disease. We'll bring together the best minds, we'll bring together the best science that this country has to offer, and we'll work with our friends and allies from around the world as we do so, because we are in the midst of a war against an invisible enemy, and it is a war in which all of humanity is on the same side. And history has shown that when the world unites against a common foe, then we will prevail. As the Prime Minister said yesterday, mass testing is how we unlock the coronavirus puzzle and defeat it in the end. But in the meantime, while the disease is still spreading and the government builds up its ability to test at mass scale, the most important thing for people to do is to stay at home, to protect the NHS, and to save lives. Now I'm going to turn to Steve Powis, who's going to set out some of the details of where we're up to in our fight against coronavirus. Steve.
Thank you, Matt. I'd like to update you with some of the information that we have been collecting that tells us how we are doing in our efforts to combat this virus, as the Secretary of State has outlined. You will be familiar with some of these charts. We have shown them before, but they are updated to show you the current position. So as everybody knows, the key thing in battling this virus is to reduce our contact with others, social distancing. And by doing that, we reduce the chance that the virus is transmitted from one person to another. We reduce the spread of the virus. And if we do that successfully, then the number of cases start to reduce. So this first chart gives an update on how we're doing as a nation in reducing that social contact. And this, as we said before, takes information from our transport services, although we do have data from many other areas of life which shows very similar data. And this shows that we continue to see a large reduction in the usage of public transport, which is a good thing and reflects the compliance that we all have with the instructions we've been given. Unfortunately, motor vehicle usage went up a couple of days ago, but it's not gone up any further, and personally I would like to see that come down a bit more. In the next slide, we begin to show how that translates into infections and hospital admissions. Now, as I and others have said previously, it will take some weeks for all the efforts that we are making to reap benefit and to start to translate into a reduction in infections and a reduction in hospitalizations. And so you can see that we are still seeing an increase in infections, although I think it's important to say, as I've said before, not to take any single day and to look at a trend over time. In the next slide, this shows how it's translating into hospital admissions. Again, it's worth pointing out that London is ahead of the rest of the country and has seen more pressure. But you will also see that other areas in the country are now seeing pressure, such as the Midlands. You'll also see, though, that this curve or this line is not getting steeper and steeper as time goes on. And that is a good thing because it means that there is a constant level of increase. And there is some indication that going forward, we might start to see it flatten off. But as I've said, this will take a week or two because there is a lag period between getting an infection and being hospitalized a week or 10 days later. And then finally, of course, that translates, unfortunately and with great sadness, into deaths. And we are still seeing the number of deaths increase. And as I've said, unfortunately, I think that will continue to be the case. We will still see those higher number of deaths for a few weeks yet until the benefit of all the actions that everybody in the country is taking will start to bear fruit and will start to impact into a reduction in deaths.
Thanks, Steve. So if we now go to questions. First question from Laura Koonsberg at the BBC.
Thank you very much, Secretary of State. You've just announced a big new target for the end of the month, but can I be clear that that would be of all kinds of tests? So the antibody test, as well as the test to say if people have got the disease right now. Can you give us a firm date by when any NHS staff that needs a test will get a test? Because in a fast-moving crisis like this, the end of the month is still a long time away.
Yes, thanks, Laura. The new goal of 100,000 tests a day by the end of this month is over all 5 pillars. Now, if one of the large-scale antibody tests that we're working on and testing comes good, then of course that will be great news. But we will not, as I said in my remarks, we will not be allowing one of those to proceed until we are confident that it is a good test, because no test is better than a bad test. So the 100,000 a day is across all 5 pillars, and I'm calling on the life sciences industry, the universities, and of course the public agencies that report to me, the NHS and Public Health England, to unite together to meet that goal. You ask about testing of NHS staff. Now, this is incredibly important, as I said. I'm delighted that we've now managed to test 5,000 NHS staff, and I'm also delighted that the absence figures, the number of people who aren't at work in the NHS due to coronavirus, is lower than had been previously reported. And I will, over the coming weeks, seek to ensure that every NHS frontline staff member who needs a test gets one, and crucially, their families, because sometimes some NHS staff have to stay at home because of they're following the rules on household isolation if one of their family gets the test. I set out why we prioritise patients first. The next prioritisation is, of course, NHS staff working in critical care, and then after that we will spread the availability of tests across the NHS and social care, and then other key workers, and then over time to the population as a whole. I don't know if John, you want to add something on testing?
Yeah, thank you, Secretary of State. Well, the initial priority, of course, is for the swab tests, because those are the tests which allow the NHS to manage critically ill patients to the best they possibly can, and also to allow NHS staff and other key workers to come back to work when they can. The antibody tests are ideally done 28 days after an infection. So in fact, the requirement for the antibody test isn't really with us yet. So the urgent priority, both types of tests are important, both are urgent, but the most urgent is the swab tests so that we can treat patients better and get staff back to work.
Fantastic. Did you want to come back on that, Laura, or?
I think, Secretary of State, we asked if there was a firm date that you could give NHS staff who need tests. You just said over the coming weeks.
Yes.
Would you put a date on that? Would you give it a deadline? Because people are very worried about this right now.
Well, they are, and I'm glad that we're able to speed it up. It will absolutely be before the end of the month, but we are, and I'm saying over the coming weeks, with 5,000 tested since this started at the weekend, we've clearly made significant progress, and I'm really glad that the figures of those in the NHS who are absent due to coronavirus are lower than had been previously reported. But we will get there as soon as we can, and I'm absolutely determined to make commitments that we can meet rather than to overpromise, and that's one of the reasons I've set out some of the difficulties and the challenges that we're facing, which we're trying to overcome in testing.
Laura, it's probably also important to emphasise from the NHS perspective the staff that we most want to test. And this is what has been reflected back to us from NHS organisations too. So of course, as Secretary of State has said, the staff in key areas such as critical care are very important. But it's the staff at home who are in household quarantine. They are well, but a member of the family is unwell. Those are the staff that we want to prioritise first. And of course, as you've heard, that involves testing the person in the household who's unwell, not the member of staff. There are staff, of course, who are self-isolating because they're symptomatic. They're important too, but of course, if they're unwell, actually what we want to make sure is that they get better. We have a duty of care to our own staff, and if they're at home sick, then it's really important that they get better before they come back to work.
Thanks very much. Next question from Robert Peston, ITV.
Hello. Professor Powers, I think you talked comparatively recently about green shoots, but if we look at the charts that you've presented today, you've got a logarithmic scale for deaths rising in a straight line, still out of control. We've had a big leap in reported new cases. Have those green shoots vanished? And then secondly, a lot of attention has been paid to the shortage of protective equipment, PPE gear for medical and frontline staff, which the Secretary of State has talked about how you're trying to correct. But lots of hospitals are reporting unease that they may run out of oxygen, sedatives, anaesthetic. What system do you have in place to make sure that other absolutely vital consumables, as I understand you call them, don't run out?
Well, if I answer the second part of that question, then cast over for the first, we have a very detailed plan for making sure that we have the full supply of medicines, including ones that you mentioned, sedatives, and all the medicines needed for those who have COVID-19 and people being ventilated. We probably have one of the strongest understandings of the supply chain of anywhere in the world because of the preparations we did for a no-deal Brexit, and we keep them constantly under review. In fact, I took a meeting on this question today. So whilst we, of course, with the lockdowns around the world, we are highly vigilant, we are currently confident that we have the supplies of medicines that are needed.
So no, I still think there are reasons to be hopeful. As I said a couple of days ago, one of the very first reasons for that is because we do see, as I have shown you, that the public is complying with the measures that the government have laid out to reduce social contact and to stop the spread of the transmission. If we didn't see that happening, then I think the answer would be no, but we do see that happening, and it's important we continue to see that happening. Secondly, as Sir Patrick Vallance said earlier in the week, we do see early academic evidence that the transmission rate in the community may have fallen below 1. And that's important because if it's the case that we are no longer passing the virus on to multiple people, so to less than one person for everybody who's infected, then that is additional evidence that infections are going to reduce. But as I've said before, and as I said a few minutes ago, it does take time for that to translate into changes in hospitalisation, infection rates, hospitalisation and death. So it is still too early. Yes, reasons to be hopeful, but reasons not to be complacent and reasons to continue for everybody to comply with those measures.
Just in case you didn't know, stay at home, protect the NHS and save lives. Still absolutely vital core messages. I think you're trying to come back, Robert.
Yep.
Yeah, it was just, I mean, obviously it would be incredibly encouraging if the rate of transmission, the R as you call it, is below 1, but how do we know? What sort of evidence are we gathering that gives us that kind of information and perhaps confidence?
Steve.
So it's possible to gather that some of the information by looking at the way that people interact with each other. So it is possible from a modelling perspective to make assumptions based on the amount of contact that we can see is going on with each other. It is absolutely the case that to be sure of that, the sort of studies in the community that the Secretary of State has highlighted will confirm that. Which is why there's reasons to be optimistic about it, but not reasons to be absolutely certain about it. And that's exactly why I said that it's too early to tell yet. But the good news is that people are complying with staying at home, with avoiding contact. And some of our very, very early evidence is that that should start to translate through to fewer hospitalizations, less pressure on the NHS and fewer deaths.
Thanks very much. Victoria MacDonald at Channel 4. Hi.
Thank you, Mr. Hancock, and welcome back. I just wanted to ask a question about you yourself were tested for COVID-19, and I wondered under which criteria you were tested. And given that the general public is still some way away from having their own tests, you say 100,000 a day by the end of the month, but that's not 100,000 people because of all the false negatives. So can you just tell us why you got the test and why the general public and many frontline staff didn't?
Yes, of course. Look, I understand people's yearning to have the test and to find out. And there's a clear protocol that's been set out by the Chief Medical Officer for who should get tests. And the decision was that those who are in senior decision-making positions, as well as those who are in the critical jobs on the front line, need to get those tests. So, for instance, I think it's quite right that the Prime Minister was tested and I was tested, and we need to roll that out now to have as many people as possible get those tests. The top priority, of course, is the patients for whom the test can be the difference between a life and death in terms of the treatment course that's undertaken. Andy Bell, Channel 5.
Secretary of State, isn't the fact that you've had to come up with your new plan today based on your 5 pillars a clear admission that up to now on testing, the government simply didn't get it right? You didn't move fast enough. And a question for Professor Powis, is it correct that a London hospital over the weekend nearly ran out of oxygen? And why did the NHS feel it necessary to issue an urgent patient safety notice about oxygen? What was the reason for you issuing that?
On the first question, we've had our plan on expanding testing all the way through. As I said in my opening remarks, we were one of the first countries in the world to come up with a test. A month ago, we had fewer than 2,000 tests. We've now got 10,000. We always had the commitment to get to the 10,000 by the end of March, which we hit. And now there's a ramp up. I've been pushing this as fast as possible since the early days of the epidemic. And I've come out with more detail on the 5 pillars now because it's quite clear that we need to bring yet more partners in to drive this national effort forward. John, I don't know if you want to add anything else.
Yes, thank you, Secretary of State. I mean, it's quite clear that the need to increase testing was recognised from the outset, and the existing arrangements in the NHS, led by the NHS but supported by Public Health England and, in fact, Roche, has made really steady progress at increasing the capacity that's currently available. And that is already meeting the requirement for testing patients and is starting to test 1,500 NHS staff a day. But it's obvious that the requirement for testing is increasing exponentially. As Robert Peston pointed out, some of our data are presented on log scale, so that means an exponential increase. And we are never going to increase capacity in the NHS exponentially. So something else had to be done. So a separate work stream, entirely independent from the NHS, has been set up to create these, what I would call mega labs. And there are 3 of them in existence already. They've been built in a remarkably short time, just 2 weeks. It's the laboratory equivalent of the Nightingale Hospital. And obviously setting those up from scratch doesn't achieve any testing at all. But we're now at the point where they are starting to do tests. And so we're really encouragingly, we're at the point where the numbers of tests being done in those labs, and therefore across the whole system, is about to start increasing much more quickly.
Steve, do you want to, just before I ask Steve to come in on your question about oxygen, I just want to underline this point about how much the NHS has risen to this challenge. As of last night, there were 1,821 spare critical care beds in the NHS. So the number of spare beds remains significantly above the demand. And so I'll ask Steve to answer specifically, but the expansion of the NHS critical care capability, that's even before we get the Nightingale Hospital into those figures, has something that I want to give a huge amount of credit to the NHS for pulling off. Steve?
Yes, so the NHS strategy has always been to be on the front foot and to get ahead of this so that we have the capacity in place to deal with any increase in cases, any surge. And as the Secretary of State has said, we are currently keeping ahead of that. So in London, we have increased the number of ITU beds, and currently 1 in 4 is unoccupied, waiting for additional patients that might have to go into those beds. And that's even before we take into account the opening of the Nightingale Hospital in East London. Clearly, oxygen and the delivery of oxygen is an important part of that capacity planning. Oxygen is the key treatment, the key supportive treatment to people who have lung infection with COVID or lung disease because of COVID. And we have been working for weeks on the oxygen supply chain. So that includes working with suppliers to ensure that increased amount of oxygen can be delivered if required, but also with all our hospitals to understand their capacity for using more oxygen than they usually would in their beds. And I'm not going to go into the details because, as you would understand, that's very technical details around how oxygen is delivered within plumbing systems in hospitals. And our trusts have all looked at that, and they have all done work to ensure that they have the capability to expand the beds that they can expand. We issue alert notices on a regular basis about all sorts of things, and it's absolutely right as we go into a different way of managing patients, so we are managing many more patients with oxygen treatment than we would normally, that we issue alerts to ensure that all trusts have the same information that might arise from anything that we find in an individual hospital. So alerts are a positive thing because it spreads rapid learning so that all organisations understand when we are doing something that we've not done before, how best that we can do that.
Thanks, Andy. Ben Kentish from LBC.
Thank you. Firstly, to the two directors, 2 academic studies have now concluded that the lockdown measures are likely to have to be in place for a significant proportion of the year. Is that your assessment too? And to the Secretary of State, welcome back to work. On the 23rd of January, before there are any cases in the UK, you told the House of Commons that Britain was well equipped and well prepared for coronavirus. More than 2 months on, you're announcing emergency measures to make up for a crucial shortfall in testing. We've all heard stories of frontline workers having to go to work without vital protective equipment. And the NHS has only about 1/3 of the ventilators that you've said it needs. Did something change in those 2 months? Was the crisis worse than we thought it was going to be? Or are we simply not well prepared or well equipped at all?
No, I think that the response of the health and social care system thus far has been nothing short of heroic. I think in terms of the preparation and how equipped we are, the fact that we've been able to expand the NHS faster than the increase in demand and have these spare critical care beds at this point in the crisis, I think has been fantastic. Of course, increasing the amount of tests is mission critical, and I've just announced that we're going to accelerate that, but we've hit the target that we set at the start, which was 10,000 tests a day by the end of March. And on PPE, we are prepared and we have the stocks of PPE. The challenge has been the distribution of the PPE to make sure that every single person of the 1.4 million people in the NHS and then the over 2 million people in social care and then the other public services that need PPE like the prisons and police and what have you, so that everybody gets it. And that is a constant effort to make sure that this distribution of PPE flows well, which we've got the military logistics people handling. So in a crisis like this, we're always going to have challenges. And I understand why people are worried about some of the some of the problems, and I understand why people are worried about the disease. You know, I've just been through it, and I understand how people feel, especially when you're on the way down before you turn the corner. So I get that, but I think that we were well equipped and well prepared, and we've been working night and day to respond to the specific problems that we have with this virus and the specific challenges that it throws up. Steve?
Well, look, I think everybody has been absolutely clear that when it comes to the end of the 3 weeks that were announced for these initial measures, that will simply not be the end of it. The virus will still be here, and we will still need to work out how we deal with it going forward. And of course, that's an issue for every country in the world. It's not an issue uniquely for the UK. And of course, in plotting that course, we will be working with other countries to understand new information, new knowledge that we can use to plot that course going ahead. I think it's also really critical to be clear that this is a new virus, and there are still things that we don't know about that we would need to know about, or would certainly help us in plotting that strategy going forward. And I'll give you a few examples of those. So we don't know, for example, how many people are asymptomatic, i.e. get the virus but don't develop symptoms. There is work going on around the world, including here, as Secretary of State has outlined, and we are ahead in many ways on this, to determine what that is. But it's not knowable yet because the virus hasn't been around long enough. We don't know how long immunity lasts, so it is likely that you become immune, i.e. You develop a response that means it's less likely that you will get the virus once you've had it, but we don't know how long that immunity lasts for. And we know from other viruses that some immunity is long-lasting, but some might last a year or so. That's not knowable yet because the virus has only been around for a few months, and it will take more time to accumulate that knowledge. We don't know what drugs are likely to work. And that's going to be really important in thinking about a long-term strategy. We have already put patients into clinical trials in the UK, and we are ramping up clinical trials, and we are working internationally. And information about drug treatment and what works and what doesn't work will be really important in a long-term strategy for this virus. And of course, vaccines are a very key part of this. Vaccines take time to develop, but I think the international effort that's going into vaccines is probably greater than any other disease in the history of mankind. And so I'm sure that we will get to vaccines, but at this stage, it's not possible to be confident when. So yes, we will need to develop that strategy, but there are things that we still need to discover and find out about this virus that will inform and aid us greatly in how that is developed going forward.
Thanks, Ben. Kate McCann from Sky.
A question for you, Secretary of State. You said that antibody testing is key to lifting the lockdown, but Professor Newton has just said that it's only effective after 28 days. So can we take from that the lockdown measures will be in place for some time to come? And for Professor Newton, Professor Powers has touched on this, but the logic behind antibody testing clearly is that if you've had the virus once, you can't catch it again. But can you be certain that sufferers do have immunity?
Well, if I take the first question, I said that testing is critical to lifting the lockdown, and hence the need to expand all parts of testing, and making sure that we understand how much the whole population has got the antibodies, because some people may, especially children, may have had the disease, develop the antibodies without having symptoms. That's pillar 4 in the strategy. That is a critical part of understanding the antibody testing as well. So testing as a whole is critical. I wouldn't read from what I said a link from the 28 days through their coronavirus status. I get that. But the number one message for everyone is to stay at home, because the more people who stay at home, the fewer transmissions there'll be, the quicker we'll be through it. That is the number one thing. I don't know if you want to add, John.
Well, no, exactly. I mean, the lockdown is an extraordinary measure to take, but there's no doubt scientifically that it's required at the moment. And it should continue, really, as long as the scientific evidence suggests that that is the right thing to do to control the spread of the infection. And the difficult thing is that we don't quite know yet how long that is going to be. But testing contributes in two ways to this. Firstly, as Secretary of State's outlined, the testing will be, when the lockdown does start to lift, the testing will be vital to allow people to differentiate people who may have immunity, as you say, from people who haven't been infected and who wouldn't have immunity. So that's one thing. But before we get there, the testing will provide the information about the spread of the virus and how infection has passed through different groups, and that information is what will be used to inform the models and to inform the decisions about the lockdown itself. So testing is important in two different ways. And just finally, on your point about immunity, the test measures your immunity, and the peak level of immunity is at 28 days. So if you want to tell somebody that they haven't been infected and they're not immune, you really have to do it then to be sure. So that's the point about the 28 days. And the measure is of an antibody, therefore there is some immunity. But the question of whether that immunity is enough to stop you being infected at all or getting serious disease is something that we need to discover as time goes on. But it would be very, I think we have to be optimistic that it will give some immunity, but we're just not quite sure how much at the moment.
Okay, thank you, Kate. Matt Dathan from The Sun.
Good evening. First of all, on behalf of all Sun readers, we'd just like to thank all NHS staff for their selfless efforts during this tough crisis. Secretary of State, you've been very honest this evening and said there'll be many bumps in the road and criticisms made, and some of them just justified. I just want to press you on this. Do you think any of the criticisms of the government so far have been valid? And if so, which ones? And secondly, just to Professor John Newton, is it now time to advise every member of the public to start wearing masks when they go outside, as we've seen increasingly across other countries? And what is your advice on mask wearing?
Well, yes, look, I think that I've been quite candid in the past about the point that we take ideas from everywhere. And my approach to tackling this as Health Secretary is to listen to all complaints and to work out what we can do better and whether people have got a point. One example is that the Labour Party said that we needed to do more in terms of some of the financial measures, and then we took those steps. So this has been an effort in which we have listened and made sure that we are always looking at complaints and criticisms to find out how we can do better. Because all that matters is defeating this virus and getting the country through it as well as possible. That is the thing that everybody is crying out for. And as I say, we are in a war in which the whole of humanity is on one side, which means that we should come together as much as possible in order to fix it. I just want to give a shout out to the health and care staff, my colleagues in the NHS across social care, and the clap for the carers has been just a magical moment. And I think so many of us felt so emotional when that happened last week, and the whole country responded in the way that it did. And I know that it's something that the Sun has been leading the charge on, and I pay tribute to your work in making sure that every single health and social care worker across the NHS, across social care, and other public servants know that they are valued for the work that they're doing, sometimes dangerous work, in order to tackle this virus.
Can I add to that? Because I'm also very grateful on behalf of the NHS for the work that you and others have been doing in terms of the media in supporting NHS staff. And I know tonight at 8 o'clock, I'm sure thousands, hundreds of thousands will be coming out to their doors, and applauding. When I meet NHS staff, actually, one of the questions they ask me is the questions that you've been asking is, are these lockdown measures, is this social distancing, stay at home working? Is it having the effect? Because we want the pressure to be taken off. We don't want to have to put this extra capacity in. Actually, we will, of course, we'll put it in, but we don't. So on behalf of the NHS, I think it's really important that all of the NHS says thank you to the British public, because there's nobody working in the NHS that doesn't underestimate the pain that we're putting people through in terms of ensuring that social distancing is maintained. It's hard. I know it's hard. It's hard particularly for the elderly. It's hard for the vulnerable. It's hard for my mother. I know exactly how hard it is. But we're all saving lives. We're taking pressure off the NHS. You've applauded and clapped the NHS. Well, I think the NHS would like to salute the British public for everything it's doing too.
Steve Swinford from The Times.
Mr. Hancock, you've talked about a new target of 100,000 tests a day by the end of the month. What proportion of that 100,000 tests will be antigen tests? And do you have a separate target for antigen tests, given that from what we're hearing, they're far more urgently needed than the antibody tests? And Professor Powers, I just wanted to come back to Laura Koonsberg's question from earlier. Can you make a firm commitment to all frontline NHS staff that they will get coronavirus tests by the end of this month? Or could they be waiting until May, June, or even longer?
Well, I'll take both of those, because I can give that firm commitment that all the frontline NHS staff who need tests will get them by the end of this month. By then, we'll be doing 100,000 tests a day. That 100,000 goal is across all 5 pillars. The thing about the blood tests and the antibody tests, as you call them, the blood tests, is that if one of the blood tests that can be done at home, that's available in large numbers across the world, that we've bought subject to them working, if one of them works well enough, then of course we'll have very significant numbers. But that is a scientific judgment, not a judgment that I can make. And therefore, I'm not assuming any of those in my figures to get to 100,000 tests a day. But the 100,000 goal that I've set for this national effort is across all 5 pillars of the strategy. If we go to Mike Settle at the Herald.
Good afternoon, Secretary of State. Is it moral for Premier League clubs to refuse to cut the salaries of very highly paid star players while cutting the wages of non-playing staff on furlough? And a question for Professor Powys, and I hesitate to ask this question, but is a second wave inevitable, and could it be worse than the first wave?
I think that everybody needs to play their part in this national effort, and that means Premier League footballers too. Given the sacrifices that many people are making, including some of my colleagues in the NHS who've made the ultimate sacrifice of going into work and have caught the disease and have sadly died, I think the first thing that Premier League footballers can do is make a contribution, take a pay cut, and play their part.
So a second wave is possible, but I think it's by no means inevitable. And as I said in answer to an earlier question, going forward, every country, this is not just a UK issue, will be working hard to develop those strategies. And I outlined some of the things that might be in those strategies and some of the scientific knowledge that we need to acquire to ensure that we don't face a second wave. So that is very much the focus of our work in the scientific community, in the medical community, and over the next few weeks, as we gather more information, I'm sure we will have more clarity on the approaches that will make a second wave not inevitable.
Okay, thanks, Mike. If we go to John Walker at the Birmingham Post. Hello, John.
Hello, and also Chronicle Live in the North East. Secretary of State, what criteria will the government use to determine when it's safe to end or reduce the lockdown? Will it be when the rate of infection falls significantly, or when a vaccine is available, or when mass testing has taken place? How do you decide when it's safe for people to leave their homes? I'd also like to ask the experts, whoever's best placed to answer this, perhaps about the high rate of infection in the Midlands. Is the situation more or less what you would have expected in a high population area, or is something unexpected happening? And if so, do you know what's causing it?
So I'll take the first and then ask Steve to answer on the second question. He might add something on the first as well. because we'll be guided by the science, as we have been throughout this crisis, in terms of when we can take steps to lift the lockdown. As Steve says, there is evidence that the rate of infection is not exponential, and although it's going up in a more like a linear fashion rather than exponentially. But we've got to get the increase in the rate of infection down before we'll be able to lift the lockdown. We have to get the curve, we have to flatten the curve, we have to get a grip on the curve before we can consider that. So if people want to see the lockdown ended, they know what to do, which is, if at all possible, like you, stay at home, protect the NHS and save lives.
And maybe I could just explain why that exponential comment is important. So we know from evidence around the world that on average one person, if there are no social distancing measures in place, one person probably infects on average nearly 3 people. And so if you just work through the maths of that, and I'll go as far as I can in my mental maths, one person infects 3, those 3 each infect 3, so that's 9 infected. Those 9 infect 3, it's 27, and then it's 27 infecting 3 each, and you very rapidly get into very, very high numbers. And so cutting down the frequency which people transmit, so you spread to a far fewer number, reduces that from an exponential curve to one that is much more linear. And of course, once the transmission rate gets below 1, it starts to go in the opposite direction. It starts to drop. So that's why we spend a lot of time talking about transmission and avoiding contacts. So that's the whole purpose of stay at home and social distancing, so that number of people that an individual infects on average, it falls. So that's really important. Now, just remind me, the question that you asked was
Midlands.
The Midlands. Yes, the Midlands. That's right. I'll come back to Midlands. So I think, as I've said previously, this virus has arrived in different countries in different ways. So in Italy, which is perhaps one of the best examples, clearly there was a lot of community spread in the north of Italy, and northern Italy had increased cases of disease far in advance of the rest of Italy. And so we know that the virus will not attack the country uniformly throughout all geographies. In the UK, London perhaps as a large urban centre with a lot of travel in and out, is the centre that has got the most infections and the most pressure on the NHS. But it wouldn't be unexpected to see that also occurring to a degree in other parts of the country as well. So I don't have any specific reasons. I think that would be hard to determine. But I think the key point is it's not unexpected to see different parts of the country at different stages in an epidemic at any one time.
Jill Lawless from the AP.
Thank you. Good afternoon. I'm wondering if you could tell us a bit more detail about the ultra high accuracy test at Porton Down. Is that a bit like a public opinion poll where you sample randomly to get a picture of the whole country? And if so, when would that start, and how soon would it give a picture of how many people in the country have had the virus? And just secondly, there seems to be some scientific evidence that the virus hasn't really been transmitted outside, just indoors. Is the government looking at that, and its scientific advisors looking at that? And if it were the case, could it lead to a loosening of the lockdown as long as social distancing remained in place?
The answer to your first question is yes, it is a bit like doing an opinion poll, and we have one in the field already, but I'll ask John to set out more details and answer both questions.
Well,
please.
yes, certainly. Well, certainly the first part is within my role. The Porton Down is a public health England lab which already does ELISA testing for antibodies. It's a well-established, highly accurate test, but it can only be done in relatively small numbers, so about 3,500 a week. And those tests are being used in a program of research coordinated by the Wellcome Trust. So there's a whole range of different studies going on. And some of these are looking at groups of people right now, looking across the population, and others are what we call cohort studies, where we take a group of people and we test them periodically to see whether they're getting infected without getting symptoms. So in fact, there are a whole range of studies being undertaken, driven by this testing facility. It's a relatively small capacity. So it would be great to have more of such tests, and we would love to get more. And if we did get more capacity to do those sorts of tests, then we could probably do more of these investigative studies. And I was told that the first results of these serology studies will be available in the next few days. So it's an impressive program, and it will help a lot when we get the results.
Fantastic. Thank you very much. And on the second part of the question, just before we go to Rowena Mason at The Guardian.
John might be.
On the second part of the
question.
Can you repeat your second part of the question, Joe?
It was that there seems to be some evidence that...
Yes, well, I would defer to my epidemiological colleagues over that. But we can try and get an answer for you. I don't think...
So I think in general, viruses such as this do spread in confined areas for obvious reasons of close contact. And that, of course, is the rationale behind ensuring that gatherings in bars, restaurants, you will have heard the Chief Scientific Advisor often talking about that those sorts of contacts are particularly ripe for spread. There is a lot of work going on environmental spread as well. That's always an important part of the public health response. That is ongoing research that is going on around the world at the moment, and I'm sure we will learn more about it in the weeks to come.
But the most important message is to stay at home. And if you do go outside for exercise once a day, stay more than 2 meters away from other people. Yeah. So it's all very well having the scientific debate, and that's very important. But I feel duty-bound to come back to the core public health advice, which is to stay more than 2 meters away from others if you are going on your daily exercise.
And to wash your hands regularly.
Yeah, so the science that I've just outlined doesn't alter the fact that staying at home and avoiding contact is absolutely the scientifically proven, and it has been for many, many years, best evidence to stop the spread of the virus, as the Secretary of State's outlined.
Okay, Rowena Mason from The Guardian.
This is a question for the Health Secretary. Are you saying that at some point the plan is to return to mass community testing, where anybody in the general population who wants a test and has symptoms is able to get one? And if so, when will that be available to them? And then secondly, to the experts as well, is the idea of immunity passports a possible way out of the lockdown for people who already have the disease?
Yes, we do want to get to mass community testing. The prioritisation is patients and then critical staff and then broader key workers and then community testing. The timing depends on how quickly we can get a home antibody test to work and how quickly we can expand the 100,000 a day of the tests of the swab test. So I can't put a figure on the timing because it depends on the science and it depends on the development of these tests. And on the second part of the question,
whether that has whether the yes.
Why don't you redo the second part of the question?
The question was about immunity passports and whether that's a good idea. But on the first part of the question, though, Mr. Hancock, I was actually asking about whether the antigen test would be freely available to the general population, not the antibody test.
Okay.
So shall I answer that and then mention the passport? So the two types of tests are very different. So the swab test, which detects the virus, is a much more complicated test, and although it is being scaled up and will be available for large numbers of people, and we hope 100,000 a day, that's a very large number of tests. The idea that that would be available to everybody across the country, I think, is unrealistic. But the other type of test, the blood test, which tells you whether you've had the disease, is a completely different methodology. And although that's innovative, and at the moment we're still trying to find the best version of that so that we have the best possible test, once we have that, that can be scaled up very quickly to a very large number of people, literally millions of people. So the two types of tests are very different, both in their objectives and in the way they can be delivered. So it is feasible to think of providing the antibody test to a very large numbers of people, but we're not quite there yet in determining which type of test that would be.
And on the immunity certificate, we are looking at an immunity certificate, how we can how people who have had the disease have got the antibodies and therefore have immunity can show that and so get back as much as normal as much as possible to normal life. That is an important thing that we will be doing and are looking at, but it's too early in the science of the immunity that comes from having had the disease that Steve spoke about earlier. It's too early in that science to be able to put clarity around that. I wish that I wish that we could, but the reason that we can't is because the science isn't yet advanced enough. But we have a program of work on to understand the science of the immunity that you get out of this, which is a global piece of work, and what you then do for people who have had the disease. And believe you me, I feel a very strong personal interest in this one now that I've been through it. If we go to Paul Waugh at the Huffington Post. Hi, Paul.
Hi there. Secretary of State, one of the consequences of this lockdown for people suffering domestic violence who are basically being cooped up with abusive partners for most of the day, there's been a spike in calls to helplines in recent days. Can you commit today to looking at least at a new emergency fund to significantly help more refuge places, and even possibly the use of spare hotel rooms to offer places of safety for women and children? And given that many of these abusers, and most of them are men, what's your message to them, many of whom might be watching right now who are abusing their partners? And to Professor Powys, the Secretary of State talked about a new figure for the number of doctors who had been absent due to COVID-19. Have you got an overall figure for all NHS frontline staff and all NHS staff as a whole?
Thanks, Paul. I will look at all options to keep people safe and to keep especially women and children who live in homes where somebody is abusive, to keep them safe. We understand the implications of the social distancing measures and the impact that they can have on some vulnerable people, in particular, who are in abusive relationships. So I will look at whatever we can do to help them to get through this when it is necessary for the whole nation to undergo social distancing. But for some people, it, of course, is much, much more difficult than others. And on the figure, I'll hand over to Steve.
8% of staff overall absent for COVID-19 related conditions. That varies by staff group and by region, as you would expect.
Great, thanks. We'll have Jerry Scott from the Yorkshire Post, please.
Thank you. A lot of focus has quite rightly been on London because that's where the majority of cases have been. But we're hearing from many doctors and nurses who, seeing what's happened in the capital, are really terrified of what they're calling the tsunami of cases coming their way. So we've heard what you've said today about supporting them, but with the gift of hindsight, what specifically have you learned from the response in London, which means that you can improve the response and support for NHS staff across the rest of the country?
Yeah, that's a great question. The first thing I'd say is that building the extra capacity is incredibly important. I'm so proud of the people who've built the Nightingale Hospital in 9 days, and the role of the Gurkhas and the military and the NHS all working together to make that happen. And we are rolling that out to Birmingham and to Manchester and to Glasgow, as I said, but we don't rule out putting temporary hospitals in other parts of the country too.
Yes, and I think we'll be saying more tomorrow on possibilities for additional Nightingale hospitals. So that's something to look out for. But I think the key thing, as I said right at the start, is that the strategy the NHS has taken from very, very early on, when we saw this situation developing internationally, was to get ahead and to ensure that we constantly have capacity which is ahead of the demand that we have and the demand that we can see coming. And that has absolutely been the strategy in London. So the strategy in London of beds for patients who require ventilation, so the most sophisticated of treatment for the people who are the sickest, has been to firstly to reduce elective surgery, so that means freeing up some of the beds that would be otherwise used, so where that surgery can be delayed a bit. Secondly, by expanding into other areas of the hospital where we can ventilate patients, so theatre areas, recovery areas, those are areas where ventilator machines are used as part of routine practice around surgery, where the oxygen supplies are all established, where the monitoring is established. And then beyond that, using the independent sector, you will have seen the deal we made with the independent sector to bring that capacity on, and then finally to build a brand new hospital of up to 4,000 beds in the east of London. And that's meant, as I said earlier, and the Secretary of State said, that we have been able to stay ahead of this curve. We do need the public, as we've emphasised throughout this, to keep to the instructions that we've given, because the demand needs to be kept under control. And any health system in the world would be overwhelmed if that demand wasn't kept under control by the sort of measures that the government has introduced. But capacity is staying ahead. And you are absolutely right, and it is occurring all the time. Colleagues around the country are talking to colleagues in London so that we can rapidly translate the knowledge that we have from London out to other centres. So I visited the Nightingale Hospital in East London 2 days ago, and I spent some time talking with a team there that is specifically looking at rapid learning from building that hospital, so that the key points, the key learning can be rapidly translated through to other parts of the country. So that we don't have to start from scratch each time. So I'm incredibly proud of all my colleagues in the NHS in standing up this capacity at such short notice. But what we learn in one part of the country, we will rapidly disseminate to help other parts of the country.
We will do everything we can to help Yorkshire prepare and help Yorkshire's NHS prepare. And the best thing that everybody across Yorkshire can do is to stay at home to protect the NHS and save lives.
And Secretary, it might be worth pointing out that the NHS testing programme is delivered across the whole country in 44 NHS hospitals and 8 regional Public Health England labs, and the 3 mega labs that we're building are distributed around the country as well. So the testing programme should have good national coverage as well.
And I gave an example earlier of somebody asked me about an alert on oxygen. That is part of that process of ensuring that throughout the NHS, when an issue or a problem arises in one part, we rapidly disseminate that information so that other organisations can learn rapidly.
Okay, Gordon Rayner from the Daily Telegraph. Thanks, Jerry.
Thank you, Secretary of State. It was March the 24th when you first talked about buying 3.5 million of these antibody tests, and the Prime Minister described them at the time as a game changer, giving a lot of people hope that we were about to turn the corner. But we were told that they may be available in days at that point. So are we now talking about weeks, months before those tests are ready for use? Yeah. And also, have you paid for those tests, or do you have them on sale or return? And secondly, just we're 2 weeks now into the lockdown. A lot of people are struggling to make ends meet or losing their jobs as a result. People understand the need for the lockdown, but you are able to tell us how long it's going to last. So do you as a government now accept responsibility for failing to have an adequate exit strategy in place before you impose the lockdown?
Well, on the second point, Gordon, unfortunately, the lockdown was absolutely necessary to stop people from dying. And if you remember, the reason that we put the measures in place was because the scientists made clear that with no measures at all, 500,000 people would die and the NHS would be overwhelmed. And as Health Secretary, I was not prepared to see that happen. So the measures, I think people understand why the measures are necessary, and we want to get through this as fast as possible. The number one thing people can do to make sure this can be, we can get out of this as fast as possible, is to stay at home and to follow those rules. On the testing, we've now bought 17.5 million tests, subject to them working. And we're undertaking those tests, of the tests. As I said, the early results of some of them has not performed well, and we are, but we're hopeful that they will improve, and that the later tests that we've got our hands on will be able to be reliable enough for people to use them with confidence. If I go to Kevin Schofield at Politics Home, who I think is going to be the last question.
Hi there, Secretary of State. Less than 3 weeks ago, the advice to the public was still that it was okay to attend large gatherings, and we saw lots of people at Cheltenham, for instance. Now we're seeing record death rates day after day. Did the lockdown come in too late? And can I also ask, on the 100,000 tests a day pledge, Boris Johnson said the target was 250,000 a day not so long ago. Has that now been ditched, or does the 250,000 target still remain for some point in the future?
Yes, we do hope to get to 250,000. The commitment that I'm making today is that our goal is 100,000 by the end of the month. The reason I've made that is because I want to bring this whole national effort to bear on that, and then we'll keep going once we've reached that 100,000. And so, absolutely, I stand by the commitment that the Prime Minister made of 250,000. On the first point, in a way, the last two questions have been counterpoised. We took the right measures at the right time, and on the basis of the very best available science. And I know some people said that we should have moved sooner. Some people said we should have moved later. The challenge is that these measures are stringent. We get that. And they've got to stay in place for them to work, which is why we followed very carefully the scientific advice in terms of the timing of when to bring them in. I think that answers all of the questions. I want to just end with one final shout out, because we've said a lot about how brilliant the NHS is. I also want to thank each and every person working for Public Health England. They have done remarkable work and remarkable science during the whole of this crisis. They sometimes, because they're working in their labs, they don't get the same frontline recognition sometimes as others. But a great big thank you to everybody at Public Health England, because they have been working round the clock to keep you safe. And on behalf of the whole nation, we're very grateful to Public Health England and the whole team there. Thank you very much indeed. That concludes this daily press conference, and no doubt see you all again soon.